Welcome to The Explainer. Today we're diving into something absolutely crucial, but honestly pretty often misunderstood, and that is lab diagnostic testing at Paradise Medical Center Primary Care. I want you to think about the human body for just a second. It is arguable the most sophisticated, complex machine on the planet. But unlike your car, it doesn't exactly come with a built-in check engine light flashing right on your forehead, right? So how do we actually know what's going on under the hood? Well, that is exactly what we're going to explore today. We're going to take those complex, jargon-heavy lab tests and translate them into simple dashboard indicators for your body, giving you a crystal clear picture of your health. All right, let's look at our roadmap for today. We'll be hitting the power of diagnostics, decoding essential blood panels, looking at targeted health screenings, walking through the actual testing process, and finally exploring what Paradise Medical Center is all about. Let's get right into it. Section 1, the power of diagnostics and really understanding your body's dashboard. I love this core philosophy from the clinic. Accurate diagnosis requires reliable testing. It sounds incredibly simple, right? But man, is it profound. You literally cannot fix what you can't accurately measure. Without real, reliable data, trying to treat the body, well, it's basically just well-intentioned guesswork. So what is diagnostic testing? Basically, these are the laboratory services used to accurately screen for, diagnose, and monitor all sorts of conditions. In totally practical terms, these tests take the guesswork completely out of healthcare. They give us clear, objective, data-driven insights. They are the exact gauges on your dashboard telling your doctor whether your systems are running hot, running cold, or just purring along perfectly. Section 2, decoding those essential blood panels. Let's read the gauges. Now, if you've ever had an annual physical, you've probably heard these big acronyms thrown around. First up is the CBC, or complete blood count. This measures your red and white cells plus your platelets. Think of this like a check on your body's defense and oxygen delivery systems. It screens for things like anemia, infections, and your overall immune function. Next is the CMP, or comprehensive metabolic panel. It checks blood sugar, electrolytes, and how your kidneys and liver are doing. If the CBC is your defense, the CMP is kind of like checking your plumbing and power. It gives us a fantastic snapshot of your overall metabolic health. And finally, the lipid panel. This one breaks down your cholesterol, total, LDL, HDL, and triglycerides, and it serves as the primary gauge for evaluating your cardiovascular risk. Now, here's a really vital distinction between tests, specifically looking at the CMP versus the hemoglobin A1C. The CMP measures your blood sugar at the exact second your blood was drawn. It's a broad snapshot. But hey, your blood sugar can spike just because you ate a donut right before your test. So a snapshot can actually be a bit misleading. The A1C, on the other hand, measures a highly precise 3-month average of your blood sugar. And that timeline, it simply doesn't lie. It's an absolute game changer for precise diabetes diagnosis and prediabetes screening. Moving on to Section 3, targeted health screenings, where we check specific systems. Beyond those general panels, Paradise Medical Center also runs highly targeted tests to really complete the picture of your overall health. Take thyroid function testing, for example, checking your TSH, T3, and T4 levels. This can diagnose hypothyroidism or hyperthyroidism, which literally dictate your energy levels and your weight. Then you've got urinalysis, which screens for things like urinary tract infections or kidney disease. They also run super targeted checks for vitamin levels, hormone panels, and STI screenings. Every single one of these gives the clinic a high-resolution, focused look at a specific system in your body. Section 4, the testing process explained. Let's talk about the logistics at the clinic. So a very natural question to ask right about now is, well, how does the testing process actually work? Is it a huge hassle? Do you have to trek out to some massive, crowded hospital lab? Let's break down the incredibly simple logistics involved in getting these important metrics at Paradise Medical Center. It's actually incredibly streamlined. Step 1 often starts with fasting for about 8 to 12 hours prior, especially if we're doing lipid panels or fasting glucose tests. I know, nobody likes skipping breakfast. But listen, this is a crucial step for ensuring your dashboard reading is 100% accurate. Step 2 is convenient in-office sample collection right there at the Westchester location. And Step 3 is a wonderfully rapid turnaround. Your provider will actually have the results back and be ready to review them with you in just 1 to 3 business days. For many of us, the very next thought is, okay, what about the cost? Well, here is some serious logistical peace of mind. Most health insurance plans actually cover physician-ordered lab work. Now, of course, coverage is going to vary by your specific plan and the exact test being run, but you can always just call their team at 305-676-8217 to verify your benefits before you even walk in the door. Which brings us to Section 5, about Paradise Medical Center, your Miami health partner. What's truly unique here is the environment where your care happens. Paradise Medical Center operates a dual clinic model, offering both primary care and medical dermatology right there in Westchester, Miami. It was founded by Dr. Teresa Moreno, a doctor of nursing practice, and her fully bilingual team takes a totally different approach to your data. They don't just hand you a confusing printout full of numbers and send you on your way. No way. Dr. Moreno and her team personally sit down and thoroughly interpret all the findings with you so you understand exactly what they mean for your health. And this all feeds into a much broader strategy of holistic care, because your lab work doesn't just exist in a vacuum, right? Paradise Medical Center integrates this lab testing directly with annual physicals, EKG heart testing, and chronic care management. So let's say that A1C test we talked about earlier shows you've got type 2 diabetes, or your lipid panel comes back with high cholesterol. You don't have to go scramble to find another doctor. They manage that chronic care right there entirely under one roof. So that brings us to one final really vital question. Are you ready to stop guessing and start knowing exactly what your body's dashboard is telling you? We've seen today just how powerful, simple, and accessible these diagnostic tests are. Your body is quite literally communicating with you every single day through these hidden metrics. The real question is, are you finally ready to read the dashboard? Thanks so much for watching this explainer. Until next time, stay curious and stay healthy.